I'd also like to share that we're working with private insurers to help improve and increase the insurance coverage for medical cannabis patients as a precursor to getting provincial coverage for patients in Canada. Today I'm going to share some results from a national patient survey that we conducted in January. It's the largest patient survey ever conducted in Canada with 2,032 responses, and I think it'll help illustrate some of the ways that end users are using medical cannabis in Canada, because there's a lot of overlap between the patient population and the recreational cannabis population as well. So the average age of this particular population was 40 years old. So we actually see that it's actually middle-aged individuals typically who are seeking medical cannabis. A lot of the time they've had treatment failures, and they're seeking alternatives to their current prescription drug use. In terms of primary conditions, we find that mental health, which is a grouping of insomnia, mental health, and post-traumatic stress disorder, is actually the #1 reason why patients are using medical cannabis. That covers 40% of all patients in Canada. And that's closely followed by pain, which is a grouping of arthritis, chronic pain, and headache, which represents about 37.5%. So what you see is about 80% of patients in Canada are currently using cannabis as a treatment for pain or for mental health. In terms of average use, we see that patients report using on average about 1.5 grams per day, and that 78% of patients actually use 3 grams or less per day. So you're not seeing large patterns of use here. That data is consistent with research that's been done in Canada and the US, as well as in Europe over the last few years. It shows that most medical cannabis patients use between 0.5 and 1.5 grams per day. In terms of primary method of use, I have good news to share, because I've been doing this kind of research for the last 10 or 15 years. And in this survey, we find the primary method of use reported is vaporization at 31%. It actually beats out joints and pipes and water bongs that might have been more popular in the past. So this is a really health-conscious shift that we're seeing from a medical cannabis population. But I also think it has policy implications as we move to regulate even the vaporization of products in Ontario and throughout Canada. The kind of key focus area of my research is cannabis substitution effect, which is the way that patients as well as recreational users consciously and subconsciously use cannabis instead of using other substances. So I'll share a bit of data on that from this survey today. We do find that out of this survey, which once again is by far the largest survey of Canadian cannabis users to date, 69% of patients report substituting for prescription drugs. So they're using cannabis in order to reduce their dependence on prescription drugs. But we also find ad hoc substitution for alcohol by 44%, substitution for tobacco by 31%, and substitution of illicit substances by 26% of the population that had previously used these substances. Now, I like to get a bit more granular with my data, and so when patients say they substitute for prescription drugs, I ask them, well, can you name 3 prescription drugs you're substituting for, or up to 3? And it should be no surprise, knowing that patients are using cannabis for pain and mental health, that 35% of the substitution is for prescription opioids. Now, that's closely followed by antidepressants at 21%, and then non-opioid pain medications at 10%. We also see very high rates of substitution for benzodiazepines, which are nearly as problematic in our society as opioids are in terms of dependence and public health impacts. I wanted to get even more granular than that. So when patients cite that they substitute for opioids, I ask them, are you substituting at 25%, 50%, 75%, or are you giving up opioids altogether? And what we found is of the 458 patients that cite substitution for 610 total opioids, understanding some patients use more than one type of opioid, a full 60% were given up altogether at 100%, and a further 18% were self-reported to be given up by 75% or more. In terms of alcohol, we get similar data. 513 respondents who substituted for alcohol, 31% of those say they gave up alcohol altogether, just as a kind of ad hoc effect of introducing medical cannabis into their course of care. Now, I want to use that as a segue to look at some of the research that we've seen come out of the US, both in terms of medical cannabis states and the recreational cannabis states, because I think it can help inform what we can expect here in Canada. Over the past 20 years, over 20 states, as you know, have legalized access to medical cannabis, and right now 8 states have also legalized recreational adult use of cannabis. Now, this has led to significant impacts on public health and safety. That includes a reduction in opioid overdose deaths. And in fact, there's a study published in the Journal of American Medical Association that showed a 25% reduction in opioid overdose deaths in medical cannabis states compared to the neighboring states. And the longer the medical marijuana program was in place in the state, the greater the effect. We also see reductions in alcohol-related automobile fatalities, reductions in violent crime and homicide, reductions in suicides. And I heard this answers one of the questions we heard today. We also see a decline in teen use of cannabis. And in fact, there was a report that came out for a national survey just last week that reported that teen use of cannabis has now declined to a rate, it hasn't been lower since 2002. So we're seeing a significant decline in the teen use of cannabis. We are seeing a slight increase in the use of adult use of cannabis, but interestingly enough, it's also accompanied by subsequent decrease in the use of alcohol and associated harms. Now, all of the harms that I've mentioned that are reducing right now, whether it be violent crime, homicides, suicides, or otherwise, the researchers suggest are being reduced because of that substitution of cannabis for alcohol. Now, other impacts include that great impacts on taxation. Colorado now makes more money on the sale and taxation of cannabis than they do on alcohol. This in the home of Coors. And also on job creation. In 2015, Colorado created 18,000 jobs and generated $2.4 billion in economic activity through their cannabis policies. That leads me to a discussion that I think is important for this committee to consider, which is the importance of brands when it comes to defeating the black market. We've heard today in previous speakers talk about the fact that right now, if you go online, you can order cannabis from 20+ different sources online across Canada. None of those are legitimate sources of cannabis, and it'll be incredibly important to allow Canadian consumers to differentiate between the illicit market and the new and emerging licit market. And one of the ways that they can do that is through the importance of brands. So the rationale for responsible branding directed to adults includes eliminating the confusion between the illegal and legal markets, to allow professional companies to separate themselves from less scrupulous competitors, to differentiate high-quality products from low-quality products, and to provide an opportunity to educate consumers about responsible consumption. Now, this has started an initiative that's taking place right now between a number of the licensed producers in Canada. In fact, 16 licensed producers representing 90% of the medical market right now, and both industry associations, Cannabis Canada as well as the Canadian Medical Cannabis Council. This is an initiative that we're doing with Advertising Standards Canada to develop a self-regulatory regime to allow responsible branding to adults when it comes to the recreational access to cannabis. Now, the principles of this initiative are that marketing by licensed producers will only promote brand preference, will not attempt to influence adult non-consumers. The marketing by licensed producers will not be directed to persons under the age of 18 or whatever the limit is at the individual provinces, be it 19 or higher in individual provinces. That all advertising messages will contain responsible use statements, which goes much further than what we see from the current alcohol industry. That licensed producers may voluntarily obtain pre-clearance of advertising campaigns in order to ensure they meet these guidelines. And that licensed producers agree to adhere to provisions of the Canadian Code of Advertising Standards. So in conclusion, I'd like to say that medical cannabis, as I've reported, is primarily being used in the treatment of chronic pain and mental health. The medical cannabis patients commonly self-report substitution of pharmaceutical opioids, of alcohol, often leading to complete abstinence of the substances identified. And the branding can not only reduce the harms associated with legalization and regulation of adult use of cannabis, but can also maximize the potential public health and safety benefits. Thank you very much for your time today. I really appreciate it.
And thank you for your information. The report that you're going to submit will be available when?
We're going to be submitting it by the end of the day,
okay.
And I think we're going to make use of your translation services here to be able to translate some of that. We're also going to be submitting a brand new publication from a study that I've done called Rationale for Cannabis-Based Interventions in the Opioid Overdose Crisis. I'm happy to speak to that today if there are any questions regarding the use of cannabis and opioids, and another study as well that I've done on substitution of opioids as well. Thank you very much.
Thank Thank you very much. Now from...
Question I have for Mr. Lucas has to do with possession limits. I think that you said that when it comes to people that are receiving medicinal marijuana, 78% of them are using less than 3 grams a day. And so within C-45, the possession limits for personal possession have been set at 30 grams, which would be 10 days of, like I would consider, a fairly serious marijuana use. What do you think of those limits? Do you think those are reasonable for personal possession, or would you like to see those reduced?
I think that that this is a fine starting point in the absence of available data on how much individuals might use. I think that this would cover a few days of use, perhaps someone who's traveling who had a particular who wanted to access product at a of a certain quality out of a certain outlet. I think that 30 grams seems like a reasonable limit. I don't think that we want to encourage people to be going into cannabis stores on a daily basis in order to pick up their product any more than we will want people to pop into the beer store on a daily basis. The evidence suggests that when it comes to the recreational use of cannabis, it'll be quite different patterns of use than medical. With medical, when we're talking about chronic pain and mental health conditions, these are chronic conditions, and they usually end up seeing chronic use. And in fact, with medical cannabis patients, the survey I just shared, 74% of patients use daily. With recreational use, I would expect it to be more towards weekends, and in fact for that use to be lower than what we're actually seeing right now with medical use. And you can actually reduce use considerably by encouraging vaporization and also the use of extracts, which are much longer lasting. So extracts and edibles would further reduce that use.
Excellent. One more question. When it comes to the bill and it's talking about being able to promote cannabis, I see a real difference between people that are engaged in the medical marijuana industry, which is growing globally. Tilray has moved into my community with a facility that exports to 5 countries. And I would think as a product, you do need to promote and brand, and to be free to do that on your webpage and in other countries. And it looks quite restrictive in C-45 that would not be allowed for medical marijuana producers. I can understand why we don't want to encourage that recreationally to make it look sexy or wonderful for younger people. But could you comment on whether you think that's limiting?
Sure. We are currently limited, like all prescription drugs in Canada, in terms of our branding already. And in fact, that branding is much more restrictive than we see for alcohol and tobacco as it stands right now. No advertising. You won't see a magazine ad or otherwise promoting Tilray or any of the licensed producers in Canada. We do feel that it's important, however, for patients to be able to make informed choices, for us to be able to reach out with public health-centered campaigns and provide information, particularly for the recreational users who might be coming into this system and not know how to safely use products, whether it be the difference between smoking or vaporization and edibles, and also being able to encourage people to stay away from smoking where possible. So I think that it's very important that we're able to get some of that messaging across. And I just want to share one concept that's very important for us to consider in this. We are talking a lot about reducing the harms of cannabis, which is absolutely appropriate because that's one of the concerns as we move towards legalization. But as an academic researcher, if you're doing research on humans, you have a joint responsibility, and they're equally responsible when you're developing a new drug or introducing a new product. You have to reduce the harms to end users, and you have to maximize the benefits. And I think that this committee has a chance to do both, not only reduce the harms associated with cannabis as it's introduced in legalization, but reduce the impacts of course, prohibition, but also maximize the benefits of this adult access. And I shared some of the benefits in the reduction of alcohol use that we've seen in the U.S. states as well, and of course the reduction in opioid use as well. Thank you.
All right, time's up.
Many producers that, as you've said, we need product differentiation, enough information, not only to distinguish the products from the illegal market, but from within the legal market, there will be different products that will be produced by different producers which have different characteristics. Then there's the need for sufficient information on the packaging so that the customer actually knows what it is they're taking and knows what it's for. And finally, as you said, to compete effectively with the illicit market where there will be no rules whatsoever on how they brand. So I'm going to turn to you, Mr. Lucas. Do you have any feelings on that? I'm looking specifically for your views on what is currently in C45 contained in Section 26, because it is a very narrow set of restrictions on the labeling and advertising right now. And again, I'd like your advice on whether you think it's too narrow.
I worry that it might be, and once again, it's with the idea of maximizing the benefits of this step that we're taking here in Canada. I understand the cautionary approach. We're the first Western nation to be moving towards this. But the evidence that we have out of the U.S., the evidence that we have out of other jurisdictions, including Portugal, that have decriminalized, evidence out of Holland that's had coffee shops for a long time, is that we keep considering this as an add-on to alcohol and tobacco, and we're using a similar lens. Should we regulate like alcohol and tobacco? I need to remind committee members that this is not either. That if we look at any of the research, not one side of the research versus another, any of the research that's looked on the public health impacts in terms of healthcare utility, in terms of public safety impacts of cannabis compared to alcohol or tobacco, let alone the illicit substances, shows it to be a much, much safer substance. That doesn't mean we should be championing its use, but does mean that we shouldn't be disadvantaging it when it comes to access compared to alcohol or tobacco. We think that Ontario's taken some interesting first steps to start getting cannabis and be ready for July of 2018, but we're talking about 60 shops perhaps at the onset. There's over 600 outlets in Ontario where you can purchase alcohol. I'm obviously not counting every restaurant and bar also, which would put it in the tens of thousands.
I don't want to get into distribution yet. I want to stay on branding and labeling. You made a very interesting, you raised the issue of should this be regulated more like tobacco or alcohol, or maybe neither. Some have advised me that they think that cannabis should be regulated in terms of advertising and labeling more like alcohol, because unlike tobacco is a uniform substance, whereas cannabis, like wine, for instance, has different characteristics. The CBD and the THC levels, particularly combined with the toluenes, make it almost, there's a panoply of different effects and types, and that this is important information both for customers to differentiate and to compete with the illicit market. So I'm reminded, like, this legislation says that you can't set out a depiction of a person, character, or animal, whether real or fictional. And I'm thinking you walk into a liquor store and you can have Wayne Gretzky Winery. And I'm thinking of the way people differentiate between wines, which is also a product that you keep away from children, that there are a lot of restrictions around what can be said on it. And I'm just wondering if that's a more appropriate analogy for us than a plain package of tobacco.
I think that you're absolutely right. What we're supportive of are bans on lifestyle branding. We don't want to celebrate cannabis use. We don't want to see anyone being depicted taking any risks, doing anything, overly athletic, etc. So that kind of lifestyle branding, we would not support at all. But we think that where adults only can congregate, such as the equivalent of liquor outlets, the equivalent of bars or consumption sites, we feel that there should be some ability to be able to speak to those adults, to be able to share messaging on different products and product effects, and that can be done through brands as well.
I want to turn a bit just to products.
For the medical cannabis industry representative here today, some people have voiced concerns that legalizing recreational cannabis will result in the reduction of available medical cannabis. Others have said that allowing more producers will be benefit for medical users. What benefits or medical users do you see coming from this legislation?
Well, I think the first benefit, hopefully, and we've heard some messaging from the federal government, this will give an opportunity to reconsider the taxation of medical cannabis. And right now, medical cannabis patients pay provincial tax as well as federal tax. And we feel that that's inconsistent with the current use of medicines in Canada. So that'd be the first benefit. I think the second benefit is going to be a destigmatization. We feel that the legalization of recreational use of cannabis will actually allow the medical community to consider the medical use more fully and more comprehensively. And the quicker we can get it in pharmacies, the more normalized the use of medical cannabis will seem. So we actually think that these steps forward to legalize recreational adult use will help in the normalization or destigmatization of medical cannabis as well. And also we're seeing a lot of funding going into studying recreational use right now that I think will be beneficial in terms of looking at long-term patterns of use for medical cannabis as well. We heard from Dr. Ware today about some of the research he's he's hoping to do. I'm involved in a number of research projects, clinical trials on PTSD, and examinations on cannabis as a substitution for opioids. And I think that that research will help us better understand, once again, the potential harms associated with cannabis, but also the potential benefits of legalizing adult recreational use.
Oh, thank you.
Thank you.
Following task force recommendation, the government will maintain the medical cannabis regime for people who have authorization from the medical professionals. The task force also recommended that this be reviewed in 5 years of new law, which the government intend to do. How will medical patient benefit by maintaining separate access for their use?
Well, I think that there's certain types and preparations of cannabis, and we've heard from our friend Mr. Jones about the benefits of high CBD cannabis strains. CBD is not impairing. It's not something that we would expect recreational users to typically be seeking out. If you've heard about the medical use of cannabis in the treatment of pediatric epilepsy, those are all high CBD preparations, and in fact, Tilray, my employer, is involved in a clinical trial at sick kids looking at high CBD extract products as a treatment for pediatric epilepsy. So those products, without maintaining a strong and robust medical cannabis program, will likely disappear from the recreational program because they're simply not impairing. They won't get you high. So there'll be not a lot of motivation for that production of those. So protecting products like that, as well as the use of capsules, orally ingested products, in order to discourage the smoking of cannabis, I think is going to be a very important part of what we can expect in the medical system. I do want to also suggest that you asked a very important question. Will patients still be able to access medical cannabis when recreation comes around? And there's certainly some companies that are clearly hedging their bets more on recreational cannabis and that are advertising or marketing themselves even today as more as recreational cannabis companies. But there are those of us who are determined and focused on the medical cannabis patient, putting money and research into medical cannabis, and we'll continue to try and meet the needs of patients across Canada as best as possible through legalization into the future.
Thank you.
To that, to be very specific, we do testing on biological impurities, yeast and molds, heavy metal concentrations as well. Pesticide testing is also mandatory as well. And so I can say with some tremendous confidence that the international community right now looks to Canada as the safest, most consistent supply of research as well as medical grade cannabis anywhere in the world. We're currently providing cannabis through the Special Access Program for pediatric patients in Australia, for clinical trials in Australia on cancer-induced nausea and vomiting. We're distributing cannabis extract capsules in Croatia. A number of companies in Canada are exporting to Germany right now within their strict and very medicalized system. So we are really, truly an example for the world in terms of the highest possible quality product. And a number of our members, not just of CMCC, but also of Cannabis Canada, are now GMP certified, which stands for Good Manufacturing Practices. That's the same high level of quality being used to manufacture pharmaceuticals all around the world. It's an international standard that supersedes the GPP regulations that we're governed in here in Canada, so I have great confidence in the safety and security and quality of that supply.
Okay, thanks very much, and that completes our 7-minute rounds. Now we'll go to 5.
Last question, Philip. So I think I heard in your testimony that I've heard that one of the biggest complaints or concerns that's in my writing that I've heard, not that I've heard a lot, but is that this is a gateway, and that cannabis is a gateway to harder drugs. But I think I heard you say that actually it's an exit strategy from harder addictions and more difficult drugs. Could you just elaborate on that a bit?
That's correct. No one on this committee would dare say that cannabis is completely without harms, so to be clear. But the level of certainly dependence on cannabis and the severity of that dependence is limited to about 9% of the population that use it on a regular basis, and the severity is much less than you would see in terms of dependence levels with tobacco, alcohol, or otherwise. More and more research is starting to suggest that not only is it not a gateway drug, that's been disproven over the last 20 years, it's not a stepping stone drug, but that for many it can be an exit drug to problematic substance use. In some cases, it's very conscious. We have doctors prescribing cannabis deliberately for the treatment of chronic pain to deliberately reduce the use of opioids by patients. But in other cases, it's completely subconscious, like we're seeing in Colorado right now, the only state in the U.S. where you didn't see an increase in beer consumption last year. because of legalization efforts. So it happens at the population level. And just to clarify, because I heard earlier some information, I just want to clarify. In Colorado, there is research suggesting that youth use has gone down. It's moderate, it's about 12%, but it has gone down. And I also wanted to mention, because you mentioned women increasing the use of cannabis, we are actually seeing women and seniors being the largest group right now coming into the medical cannabis program. And that alone may account for the statistical bump that we're seeing in terms of women using cannabis as well. As you've suggested earlier, we might see initially on legalization a 2 to 4% increase initially. That'll flatline once again and go back to regular use. What you'll typically see is that those who are using will continue to use, but right now, the law is not dissuading a lot of use, and that's one of the challenges when we talk about youth right now. The law is not controlling black market distribution to children. If I could add just one more thing, I'm a former high school teacher. I once asked a grade 11 class, what drugs can you access in the next 24 hours? And they listed off LSD, and they listed off mushrooms, and they certainly listed off cannabis. And the two toughest drugs for them to access in a 24-hour period were alcohol and tobacco. Now, I'm not so old that I don't recall ways that we circumvented that, even those regulations. But once you take cannabis out of the black market, once you take a drug out of the black market, you put in age restrictions and ID and take the power of the black market away from distributing that drug, you can really impact rates of use. And so I think that we can expect, actually, those youth rates to actually go down post-legalization, despite the fact that it may seem counterintuitive in many ways.
Thank you.
Ms. Gladue.
I'm going to move on to Mr. Lucas. So there's a lot of talk about access to medical marijuana or medical cannabis versus access to recreational cannabis. It's as if they're two different things. So are they really two different things, or are we talking about just cannabis for medical use versus cannabis for recreational use?
Well, I think it depends in the preparation. The answer is yes to both of those. They are different in that, as we've discussed, CBD would typically not be desirable from a recreational point of view. That's not why people use recreational cannabis. And in fact, the reason that we're only starting the research on CBD over the last 5 or 6 years, despite the fact it was discovered first over 40 years ago, is because there were no high CBD strains that were available in the recreational market initially. And it's only the establishment of the medical system here in Canada and in the U.S. that's motivated people to breed and to develop these high CBD strains that have become so efficacious for so many people now. So that is a distinctive characteristic in many ways of medical cannabis. Now, that's not to say that THC doesn't have therapeutic properties. It's a powerful analgesic, anti-inflammatory. It has a number of therapeutic properties in and of itself. So the same strain can be used for recreational purposes that can be used for medical purposes under some circumstances, but I think that there are quality control methods of ingestion, for example, that might be more distinguished for medical use versus recreational use. If you want a long-lasting, even effect, then oral ingestion makes the most sense for that. But for example, for someone wanting rapid onset of effect, let's say you're suffering from a migraine and you're starting to get the auras associated with migraines or the nausea associated with migraines, oral ingestion isn't going to make much sense. So vaporization in those cases, or maybe an oromucosal spray would make the most sense. There's also ongoing product development, for example, for patches that would be usable in terms of slow delivery of medicinal cannabinoids into the system as well. So a lot of the research right now being done not just by licensed producers in Canada, but by pharmaceutical companies around the world are looking to modulate the endocannabinoid system that we all have in ourselves. And that's quite different than the recreational use that we see where people are, for example, making high THC gummy bears.
Mr. Davies.
Mr. Lucas, I want to ask a question about supply. The Parliamentary Budget Officer has studied this and said that in 2018, Canadians aged 15 and over will consume an estimated 655 metric tons of cannabis. By 2021, this could rise to 734 metric tons. I'm just wondering, in terms of the present medicinal cannabis production, that's the only legal production, are we going to have enough producers licensed to meet demand legally in July 1, 2018?
I think I don't think anyone would ever tell you we're going to meet demand on July 1st, 2018. The licensed producers that are established right now, and there are 55. At this time last year, there was probably 25. So we are getting more and more folks online, are expanding rapidly, moving into greenhouses in order to increase supply. But as was discussed this morning, one of the biggest challenges that we saw in Washington State and Colorado, despite a long lead time for legalization to be in place, was a shortage of supply. We've seen the same thing in Nevada recently as well. I would expect to see some initial supply shortages and then a regulation or a flatlining happening a few months down the road as well. I think one of the bigger concerns is whether we're going to be able to incentivize people currently using the black market to move into the illicit system. And if it's taxed too high, or if access is in any way more inconvenient or less affordable than it is through the black market, then I think that we're going to have a lot of trouble convincing people who are currently buying from the illicit market to move into the illicit market. And that's part of the task, I think, and responsibilities of this group and of the current government to make sure that accessibility is not an obstacle to access.
I was going to ask, is there a risk that we could divert medicinal cannabis so that medicinal cannabis users are not getting access?
I think that's ultimately up to the individual companies who are moving towards medical and recreational. The company that I work for, Tilray, will remain a medical brand. We're not going to have a recreational brand at all under Tilray's heading.
Thank you.
Thanks.
Mr. Tesarowski.